Good morning. Good morning. Excellencies, distinguished colleagues, ladies and gentlemen, nutrition colleagues and other colleagues from around the world, I'm so happy to be welcoming you here today to the World Food Program. This is the second year in a row that we've had the honor of hosting the launch of the Global Nutrition Report in Rome, and we're just so pleased to see how the participation in this launch grows every year. Like the SOFI report, which annually reports on the status of food security and nutrition around the world, the Global Nutrition Report provides us with the facts and the figures and the information that we need to better understand the nutrition status of our global population. Now, this year's facts and figures are sobering in many respects. There are declines in malnutrition, but it's moving very slow, too slow. And I look forward to hearing more from our panel today on their analysis of where we're lagging behind on our global targets, where we're making some progress, and what more we need to do to accelerate that progress. I'm also professionally and personally very pleased that today we have an all-woman panel of experts on this topic, which both highlights, I think we've got the real minds and substance behind the issue. I had a chance to hear Jessica present the Global Nutrition Report in South Africa in December, and it was a riveting engagement and participation there too from a group of experts and young people who were really committed to setting the course for the future where we are combating and addressing malnutrition conclusively. And here again, I think the work is so fundamentally important to all the work we do in emergency and in development contexts. From WFP, the information collected, analyzed, and shared in this report isn't an end in itself, but it's a very critical means that allows us to know what needs to be done to save lives, change lives, and ensure that nobody is left behind. So with no further ado, I will hand you over to Andrei Vornik. Andrei will be our master of ceremonies for the exciting event this morning. Thank you.
Thank you very much, Valerie, for those welcoming words. Indeed, welcome to you all. Good morning if you're joining us here in the flesh. Good evening, good afternoon, whatever it may be to you, wherever you're joining us from, if you are online. Indeed, we're here for the launch of the latest Global Nutrition Report, which is very data-rich. It makes for stark reading. One of the key data points is that with the clock ticking down to the 2030 agenda, we still have more than 150 million stunted children. Of course, that is not just 150 million individual tragedies, but also 150 million fewer chances of achieving the SDGs. We'll be hearing what can be done about it. If I'm going to take you very briefly through the running order today, there will be introductory remarks, there will be a formal presentation of the report, which will be interactive, and then we'll have a panel of distinguished guests, and again, there will be a chance to ask questions. A few housekeeping rules. Safety first. The emergency exits are on either side, should that become necessary, which is highly unlikely. I hope you have all been able to join the Wi-Fi network, which is WFP-EB, as in executive board, so WFP-EB. The password is 2019.board, capital B, 2019.board, again, capital B. It should be, however, in those plastic inboxes that are on your desks. And I would kindly ask you to keep your phones on silent, but to keep them on so that you can ask questions later. It will be explained to all of us later how to do this by getting on slido.com. And finally, when it comes to the questions and answers, I would kindly request you to avoid acronyms and not to assume too much knowledge. This refers both to those who will be asking the questions as to our distinguished guests, because although we have many nutritionists among us here, not everyone is one, starting with myself, which is why I'm now going to hand over to people who know much more about nutrition than I will ever do, starting with Director of Nutrition at WFP, Lauren Landis. Lauren.
Good morning, Your Excellencies, ladies and gentlemen. I am very pleased and very honored to add my welcome to that of Valerie Guarnieri to the Rome launch of the 2018 Global Nutrition Report. WFP is proud to co-host this session with the FAO, and my counterpart, Anna Lart, will give the closing remarks today. I'm so pleased that so many of you have joined us today, both in person but also online. And I think this is our opportunity to really explore how we can spur action to end malnutrition in all its forms. Now, of course, if you want to follow the conversation on Twitter, please use the Twitter handle and hashtag. It's digest the data on the screen behind me. I think all of you will start your cell phones to send messages on this report. So I would like to introduce to you our esteemed panel. Again, my co-host, Dr. Anna Lart. Maybe Anna, you would like to stand up. She's the Director of Nutrition at the Food and Agricultural Organization. And our panel, already sort of introduced today, Dr. Jessica Fanzo, the co-chair of the 2018 Global Nutrition Report. Purnima Kashyap, the United Nations Network Global Coordinator, and Margarita Astrola, the Director of Environment, Climate, Gender, and Social Inclusion Division at the International Fund for Agricultural Development. So thank you for joining us for what I believe will be a fascinating discussion today. The 2018 Global Nutrition Report is clearly a clarion call for sustained efforts to end malnutrition. This year's report tells us that malnutrition is responsible for more ill health than any other cause. More ill health than any other cause. Today you're going to see the stark data around the burdens of undernutrition, as you might expect, but you will also see the challenge of multiple, not just double, but multiple burdens of malnutrition, undernutrition, non-communicable diseases, and obesity, which is clearly bringing a greater level of complexity to our work in malnutrition. As we know, malnutrition is devastating at all levels, from the child who's more susceptible to infection and disease, and ultimately to the loss of economic potential of entire countries due to stunted growth. But the way we're talking about malnutrition, and I hope you picked it up in this report, is really changing. We can no longer focus primarily on stunting, wasting, and anemia. This Global Nutrition Report really reminds us that adult overweight and obesity are at record levels locally. And many individuals and countries face more than one burden of malnutrition. And from my perspective, the more burdens, the more difficult the problem is to solve. But it's not all bad news. So I don't want you to start to head for the door already. We're going to clearly hear today about where there's been areas of progress in tackling malnutrition and clearly where the greatest opportunities for progress are. You'll hear that we're better equipped to tackle malnutrition and that we have more knowledge and data than we've had in previous years. And we also have a better understanding of the problem. what causes malnutrition, as well as the solutions of what is it that we need to do to tackle this global problem. It will also point out that we still have a window of opportunity to really tackle the Sustainable Development Goals in ending all forms of malnutrition by 2030. Now, before I hand over, I just want to make two personal comments. When you read a report like this, it really reflects the work or the projects that you're doing every single day, and the work that you're trying to lead as a director of nutrition. I've just spent 10 days in Yemen, and before that, I spent a week in Cox's Bazar in Bangladesh. And one thing that really strikes me is the report's plea. It defines it as a critical need to take a new approach to addressing all forms of malnutrition in crisis. So it's well known that increased rates of malnutrition are triggered by conflict, that there are, and now additional evidence really points to that there are high levels of stunting, not just wasting, that occur in protracted crisis. And it is also suggested, and is quite obvious, that pregnant women who are exposed to conflict are more likely to give birth to underweight babies and thereby continuing the impact of malnutrition across generations. Clearly, it really points to me that if we needed to reinvigorate our efforts to combat all forms of malnutrition related to crisis, all you need to do is look at the situation in Yemen today. Second personal observation as I read this report, I was really struck by the strong emphasis on diets and the fact that there's a need to improve the diet of everyone. It's not just in conflict environments. It's not just in refugee settings. But what this report really points out is that we need to redouble our efforts in school feeding programs, in our cash programming, in our emergency setting, in our development programming. And not to steal Jessica's thunder as she goes through the data in the report, just two numbers, or maybe three, that really hit me. Regardless of wealth, about a third of school-aged children don't eat fruit daily, yet 43% consume a soda. Analysis of 23,000 packaged foods found that 69% of them contained little or very poor nutritional value. So it's not just something for those people that live far, far away. It's about the nutrition of all of us, about everyone across all countries, and the food that we eat every day. If we ever need this wake-up call on the complexity of malnutrition and the countries that it's reaching with its multiple forms, this is one of the strongest reports I've read. So on that note, let me turn over to Jessica Fanzo, the co-chair of the 2018 Global Nutrition Report, to give us a full read of all the findings. Thank you.
Okay. Always have to move the microphone down. Okay, it's a real pleasure to be here. Thank you so much, World Food Program, FAO, Lauren, Landis, and Anna Lart for co-hosting this launch. I never feel the Global Nutrition Report is launched until it's launched in Rome. I think many of you have the hard copy of the report. This year was meant to be actually a data update, and I think it is our thickest report yet. So much for the update. It's a full-blown report. I hope you all have the time to read it in some depth and digest it. I think it's worth your time to read. As Lauren said, I'm the co-chair of the Global Nutrition Report Independent Expert Group. I am presenting on behalf of the Independent Expert Group, along with my colleague and co-chair, Corinna Hawkes, who is in London. So let's get into the report. Okay. So first of all, we're going to try to make this interactive, and not only during my talk, but also we hope that you are starting to think about some of the questions and comments that you have for the panel. But first, I want everybody to go to slido.com on your phones or your iPads or devices and do the hashtag GNR for the event code. And as we go through, I'm going to trigger some questions that I hope you can answer on the Slido, and we'll see where people are at. We've already been given some hints already of some of the numbers that will be asked of you, but we'll take it as we go. Okay, so about the Global Nutrition Report. I think all of you know the Global Nutrition Report is considered a neutral ground. The Independent Expert Group comes together every year, decides on the content of the report. We curate data from many different sources. And we are now in the 5th year. Lawrence Haddad was the chair of the Global Nutrition Report for 3 years, who many of you know, World Food Prize winner. And the last 2 years, Corinne and I have been chairing the Independent Expert Group. We've had 5 strong years of looking at data, and the message is still the same. There's data gaps, there's not enough funding, we need more attention to nutrition. I'm going to present what we found this year, but I will emphasize to you that it is a slightly depressing story, but we'll try to end with some positive hopes. So this year, as Lauren said, we had a few special focuses. We always present the burden of malnutrition in all its forms, more so this year than ever, really trying to present more on the overweight obesity pandemic that we are witnessing in the world. We always present the financial commitments being made by donors and domestic financing of countries that are dealing with malnutrition burden. But this year we have a couple of special chapters, one on diets and the impacts of diets on malnutrition. And we also have a chapter looking at 3 critical issues, looking at micronutrient deficiencies and the lack of information or data of who has micronutrient deficiencies. The second issue we looked at was fragility, conflict, and violence, and how that takes a heavy toll on nutrition. And the third was looking at a special nutritionally vulnerable population, that being adolescents and teenagers, particularly young girls and young women. So what progress has been made in reducing malnutrition? So I first want everyone to go to their Slido. So in 2000, there was almost 200 million children under 5 who were stunted. How many are stunted now? So if everyone can choose their answer, and we'll see what, it was already given away earlier, if you remember the number. You stole the thunder of the group. So if everyone can answer, no one's responded yet. Wow, smart audience. Give it another minute. Yeah, has everyone voted? So, okay, so majority wins. We have 150.8 million children who are stunted. Anne, do you want to go back to the... Anne is coordinating my slide deck for me. So as you can see from the slide, we've gone from 200 million children to 150 million children who are stunted. Progress has been made, but it's too slow. You know, that's 18 years of data collection, 18 years of action, and we've reduced that about 25%. But when you look at that 150 million children, that's 23% of the world's children under the age of 5 who are stunted. That's a significant amount. And as you can see at the same time, overweight in children under 5. Children under 5, overweight children is about 40 million. So we're going in the wrong direction there. We also have interesting new innovations to look at some of this data and look at progress over time using geospatial data, very micro data at the micro level, looking at who is affected and where. And this is from the Global Burden of Disease group at University of Washington, who gave us data this year. And you can see the prevalence of stunting, the higher the burden is in red over time. This is in the year 2000 in sub-Saharan Africa. And if you look over time, 2005, we see reductions. 2010 and 2015. So here you can really see the hot spots of where progress hasn't been made and where progress has been made at the micro level. 48% of countries are on track for at least one of the nutrition targets that we track. The nutrition targets for undernutrition by 2025, you can see them here. It's stunting, anemia in women of reproductive age, low birth weight, child overweight, exclusive breastfeeding, and wasting. And we also have some NCD, or non-communicable disease targets, and obesity targets that we track as well, including salt intake, raised blood pressure, which is a risk factor of stroke, and obesity and diabetes. So the next question, exclusive breastfeeding has increased by how many percentage points since 2012? So you have some options, 4%, 8%, 13%, or 10%. Interesting. Okay, so we'll stop there. So pretty close tie there between 8 and 4%. The answer is 4%. Anne, if you want to go back to the slide. Exclusive breastfeeding is really on track. It's one of the few targets that's on track to be met by 2025. And then there's some countries like Burkina Faso, Nepal, who've already met the target of reaching exclusive breastfeeding at least by 50%. So interestingly, the exclusive breastfeeding target is on track. But many of the other targets were really off track. If you look at these sets of bar graphs, the blue shows you on course, the orange is no progress, and the gray is no data across these targets. And what do you see? Well, first you see a lot of countries that are not tracking these targets. Look at the exclusive breastfeeding, stunting, overweight, wasting. Countries like the United States don't even collect on stunting. So that is a big issue, is that we've got massive data gaps. The other one that you will see is that the orange across obesity and NCD targets. Very few countries are on track to stall obesity and mitigate against diabetes. An interesting study done by the Brookings Institution, John MacArthur, found they looked at how can we achieve the SDG 2 targets, and they basically show through some modeling that only 24% of the world's countries will achieve the undernourishment target. Wasting 33%, 44% for stunting. And actually the children overweight target, we're going to reverse that. We're going in the wrong direction. So if we continue in a business as usual approach, we will not achieve the SDG 2 targets where we currently stand. Stunting is the one where we really need to be focusing on, because we see progress and there's a lot of evidence of how to address stunting, but we won't make it with a business as usual approach. It's estimated that by 2025, we'll have 100 million children who are stunted. So another 25% reduction over the next several years. And we know that conflict does not help. Countries that have conflict or are at war, civil war, or experiencing episodes of violence or fragility have higher burdens of stunting than countries who are at peace. So this is a big issue, particularly if we get into situations of climate change, water wars, food wars, resource wars. This could become a bigger issue in the next decade. Women, particular need, nutritionally vulnerable from a biological perspective, from a social perspective. We see that progress on women's nutrition is not improving. Overweight and obesity is rising rapidly in women all over the world, low income, middle, high income, rural and urban. We see anemia has not changed at all. And undernutrition has slightly come down, but it's still significant. So women are really vulnerable to nutrition and their statistics are not improving. I told you I was going to depress all of you, I'm sorry. Lack of evidence on micronutrient data. You often will see the statistic, there's 2 billion people who are micronutrient deficient. We actually did some homework on that. And that is based on the original ICN meeting, International Conference on Nutrition meeting in 1992 of 4 nutrients that were estimated. That's where that statistic comes from. So it is an almost 30-year-old statistic based on 4 nutrients. We need at least 50 nutrients to survive. So we don't have a lot of good data on that. So we need better data on micronutrient status being collected in countries so people understand how to act and where to act. Adult overweight and obesity continues to rise. Some of you may have seen a report, the Lancet Commission report that came out last week on obesity, undernutrition, and climate change, what is called the syndemic. Obesity is a massive issue everywhere in the world, and you can see the rising numbers in adult overweight and obesity in the last 15 years. We are now at 2.1 billion adults who are overweight or obese, 2.1 billion and rising. Adolescents are not immune as well. We're seeing increases in obesity in all regions of the world, both boys and girls, sometimes being affected disproportionately, depends. And as Lauren had pointed out, the diets of adolescents and school-age children are not optimal, and I'll talk about that a little bit later, but just to correlate the obesity with soda or sugar-sweetened beverage intake, you can see that 43% of the world's school-age children and adolescents consume soda every day. So almost half are getting at least 1 serving of soda every day. So how many children do you think are stunted and wasted or stunted and overweight? So they've got 2 burdens in one child. How many children do you think suffer from 2 burdens of malnutrition in their one body? You've got 150 million children who are stunted, about 50 million who are wasted, 38 million who are overweight. This is a tough question. Hey, you've got 25 million coming out on top. And that number's correct. So 25 million children are suffering from being stunted and overweight, or stunted and wasted. So we have 16 million children who are stunted and wasted, and about 8 million children who are stunted and overweight. So we've got these double burdens in individuals, young children. Countries are also struggling with double, triple, quadruple burdens of malnutrition, which makes it incredibly complicated to know how to act when you're dealing with these different burdens. 88% of countries face overlapping burdens. They have 2 or more forms of malnutrition. And you can see the statistics here. 41 countries, for example, have overweight women, anemic women, and stunted children. When we look at children who have double burdens, you can see the brunt of that is Asia and Africa. So they're experiencing at least 2 forms in these 2 regions. And countries that are dealing with multiple burdens, we see that in multiple places. Again, sub-Saharan Africa has the triple burden of the overweight, anemic women, and stunted children predominantly. Other places like the United States is dealing with obesity, Australia obesity, Latin America obesity, but again, many places have insufficient data on these other types of malnutrition burdens. So what progress has been made in improving diets? We really tried to highlight diets this year. We're going to do more of that every year in the Global Nutrition Report. We have country profiles you can download that has dietary data now for every country. We're going to talk more about food systems, food security, and its interlinks with diet in the next report. So diets of infants and young children are really suboptimal everywhere in the world. What this slide shows you are wealth quintiles, the darker blue being high quintiles, the lighter blue being low quintiles. And the orange is urban and rural. The darker orange is urban, the lighter orange is rural. Looking at a variety of infant and young child feeding practices, exclusive breastfeeding, dietary diversity among children, and really it's suboptimal everywhere. It doesn't matter with wealth, and it doesn't matter really where you live. Children are not getting the right healthy diet in order to grow and develop into the healthy adults that we want them to be. We also see that adults are not getting enough of the right foods. If you look to the right and to the left of these bar graphs, you can see different types of food groups. And if you're too much to the left, you're not getting enough of that food. If you're too much to the right, you're getting too much. And you're increasing your risk of disease and disability. And what you see is fruits, vegetables, whole grains, polyunsaturated fats, the healthy aspects of our diet. The world, regardless of wealth, from low to high income, are not getting enough of the healthy foods. What you'll see is salt, sugar-sweetened beverages, everyone's eating way too much, regardless of where you live and your wealth status. Where you see a bit of difference is legumes. Sub-Saharan Africa is consuming a lot of legumes, and we see a real splay in wealth quintile with red meat. Wealthy countries can afford red meat. Low-income countries, harder to get access to red meat. School-age children don't get enough daily fruit every day. 30% of children don't get access to fruit, fruits and vegetables as well. Daily soda was already presented. And some children are hungry, go to bed hungry every day. So the adolescent diet is also suboptimal. So when we look at these 3 groups across the lifespan, overall, the world's population is eating a suboptimal diet. So a question, and I think this was spoiled earlier, that's okay though, what percentage of packaged foods are not aligned with healthy diets? Packaged, processed type foods. That could be cookies, it could be crackers, it could be biscuits, all those kind of packaged foods. 88%, 69, 73, 45. So while people are voting, I'll tell you a bit about this study. The Access to Nutrition Foundation and George Institute looked at 25,000 products from 9 big markets of different countries. And they looked at 21 of the world's largest food and beverage manufacturers and looked at the top 5 packaged foods from those manufacturers. And they looked to see their health, the quality of the health of those products. So it's a pretty close tie between 73, 69, and 88. Okay, we can end it. The answer is 69% of products did not meet the healthy threshold and were of low nutritional quality. Okay. And you can see here those processed packaged foods eaten in different regions. We see in North America, there's a lot of consumption of these processed packaged foods, but it's declining. But there's still a high number of food sales from processed packaged foods, where you see the increases in places like Latin America and Africa, and globally you see an increase in this. So what does all this mean for diets? Well, now diets are one of the top risk factors of all disease, disability, and death. More than tobacco smoke, more than alcohol consumption, more than the opioid addiction, it's diets, these suboptimal diets. Low in fruits and vegetables, low in whole grains, low in nuts and seeds, high in salt, sugar, fat. And people are now dying more from non-communicable diseases than communicable diseases. So heart disease, stroke, diabetes, and diets are the biggest risk factor of those. But progress is being made on the healthy diet front. We see that more countries have fortification programs, so trying to inject micronutrients in the staple food supply. Governments are acting to improve diets by enlisting front-of-the-pack labeling, soda taxes, or junk food taxes. We see cities really taking action, developing food and nutrition policies for their cities, often incorporating sustainability measures as well to reduce food loss and waste and other issues. And we see a lot of community-based interventions happening. Projects like Alive and Thrive have done a lot to improve infant and young child feeding messaging and consumer behavior. So we see a lot of action happening in different places around the world to improve diets, but we need to scale it up. So what progress has been made in financing? And I'll go through this quite quickly because we have to end. Overall, financing, it's a great start, but it's way too low. Looking at official development assistance, mostly towards undernutrition and humanitarian issues, it's 1%. 1% of the ODA goes to nutrition. It's incredibly low. I've said it last year, it's a rounding error in the ODA. It's a joke of the amount of funding that's going to nutrition compared to the burden. The Nutrition for Growth commitments were met early, but still, this funding is not enough compared to the burden and the cost on society that this burden will have. On overweight and obesity and non-communicable diseases, it's even worse. It's 0.01% of the ODA. 0.01%. Can you imagine? And every country is dealing with overweight, obesity, and NCDs, and nothing goes to it. There are countries that have been prominent in donating to basic nutrition, the undernutrition mainly, UK, the EU, Canada. On diet-related NCDs, Australia has been a leader, EU, UK, Australia mainly going to the Pacific Islands, which is reeling from obesity issues. Countries themselves are investing. SUN, Scaling Up Nutrition, has been tracking 25 countries and looking at their investment, and they've actually increased their investments in their own countries to nutrition significantly, mainly to nutrition-sensitive interventions in agriculture, social protection, education, adolescent health. So we're seeing a big upswing in domestic financing for nutrition in the nutrition-sensitive space. And so kudos to countries who are taking limited resources and putting them towards nutrition and giving them equal weight to other sectors like health and agriculture. So maybe in the last just couple more minutes, yeah, it's good, the Slidos. So what percentage of countries do you think have 3 or more nutrition targets in their policies, meaning they have direct actions to address obesity or stunting or wasting or anemia or diets? What percentage of countries in the world that have nutrition policies have at least 3 or more nutrition targets? Okay, so we see 47 and 62% come out on top. And you can stop it now. And the WHO has done a review looking at policies, and they've looked at all of the nutrition policies that around the world, and they show that 81% of countries have 3 or more nutrition targets. And you can see the overweight adult and obesity. A lot of countries are now starting to think about how to address that, as well as stunting, exclusive breastfeeding, and childhood overweight. So one of the questions that we ask this year is, we know a lot. We have a lot of evidence. The uncomfortable question is not so much, why are things so bad, but why are things not better when we know so much more than we did before, than we did a decade ago? Why aren't we improving when we have so much more knowledge and information? And we argue that there's really 5 critical steps that we need to do with this information. So, and this is my last slide. The first is break down silos between malnutrition in all its forms. There's lots of forms of malnutrition, as you saw, that are affecting different people in different populations, in different places, and they overlap with each other. We need to take those in all their forms and figure out how do we address these actions. We also have different communities in nutrition, those that work on emergency, those that work on stunting, those that work on overweight and obesity and NCDs, and we don't talk to each other. How do we talk to each other and act together? The second area is prioritize and invest in the data needed and the capacity to use it. The GNR has always called for a data revolution. We still don't know all the wheres, the whos, and the whys. You know, where are people affected? We need better data, geospatial data, and we need to effectively use that data and really hone the targeting of where we act. The third is scaling up financing for nutrition. I think I made the call for that. We have inadequate funding to address all forms of malnutrition. So we're not going to make progress without that. And this year's report shows that patchy progress. Fourth is galvanizing action on healthy diets. Poor quality diets among many populations or all populations is a major risk factor of malnutrition, disease, disability, and death globally. It's a problem everywhere. No country is immune, but there's lots of solutions on how to improve diets. And last, we need to make and deliver better commitments to end nutrition in all its forms. We're at a pivotal moment. Japan 2020 Nutrition for Growth Summit will be coming soon. I hope everyone in this room takes action in Japan to make smart commitments, whether it's financial, political, social, programmatic commitments. And it's a real time to galvanize what we have, the data we have in hand, and take action on ensuring that we disprove that we won't make it to the SDGs, don't take a business as usual approach, and end malnutrition in all its forms. Thank you very much.
Jess, can everyone hear me? Does the mic work okay? Many thanks for that overview, quite detailed. Thanks for joining us on the podium, because we'll come back to you. This is where we loosen it up a little. This is going to be a panel discussion. We'll ask our guests some questions, but also this is where we want you to participate. If you can go on Slido, again, you can either ask questions or vote for the question that you think is most representative and you'd like to see answered, and then we'll take the questions in the order of the vote. So, this being said, if I can come to you first, Margarita. So Margarita Astralaga, let me remind the audience that you are from IFAD. Your mandate is quite large. It includes gender, social inclusion, the environment. Given the breadth of your mandate, what is the headline of this report for you?
Good morning, everybody. For us, of course, it's extremely important to be here because this report brings us to a reality that sometimes we don't think about, unfortunately, that we don't always have as one of the top priorities. So listening to Jessica and seeing all the reality of the nutrition situation now, of course, there are reasons for us to be happy because certain things have improved, as Jessica has sort of told us here and so eloquently presented. But for us, it's really having this transparent and global data in one place. For us, it's extremely important also to realize the gaps of information, because it's difficult to invest, to make plans, if we don't have accurate data. So it's very useful to have been able to see what has been collected. And it helps us define our investment portfolio in a more objective manner. So that's why we really appreciate having all these data. And when we look at the situation in Africa, so we say, okay, great, stunting has decreased. It has decreased percentage-wise, but then we see the amount of children that are still stunted, and we see that it's increasing. So on the one hand, we say, yeah, we have made progress, but the progress is not fast enough. And we see also these figures about obesity and the triple and double burden in some countries, and the challenge that puts on all of us that are making investments. And what is important for us, I think that also the fact that we are linking this with the silo issue, that we probably will talk about that later, but the fact that we need everybody on board, and our focal points, the people we work with on the ground are normally ministries of agriculture, or in some cases ministries of finance. And this is an issue that affects so many SDGs. It's not just SDG 1 or SDG 2. It really affects health, it affects education or ability to have decent employment. So really, it's presented, it's something that I would like all of us to remember, and our partners to remember, that when we are pushing for the nutrition agenda, we are pushing for the rural development that will not happen if we don't take into account nutrition in all our activities, in all our investments with a food systems perspective. So it's from the production side to the consumption side.
So I guess the headline would be, we could do so much better, and we need to. Purnima Kashyap, let me remind the audience that you are the coordinator of the UN Network on Nutrition. I would also like to ask you what you take away from this report, but possibly because of your role at the heart of policy overview on nutrition in global terms. Frankly, where are we failing?
Thank you, and good morning to everyone. I think from the perspective of the UN Network for Nutrition, this report is extremely timely. I see this as a report that has been put forward in a very simple language, very useful infographics, and we find this as an extremely useful advocacy tool in our engagement at the country level with the government leadership and with the UN country team. And I say this because our work goes across the various ministries, across various UN agencies at the country level. What I find in this report that has been extremely useful for us is what I call as demystifying nutrition. I think we all get very overwhelmed when we talk about nutrition as a subject. It seems as though it's a very complex, it requires some very complex learning and education, but I find talking about nutrition in the context of Sustainable Development Goals and their achievement and linking various ministries, various portfolios, and thereby various UN agencies in their engagement on nutrition, it has been extremely useful for us. I just want to give an example here. I recently was in Zimbabwe and I had a conversation, not just with the UN team, but with the government counterparts as well, who the report that we're using, the infographics for, as I mentioned, as an advocacy tool at country level. One of the things that came up was, why is Ministry of Labor not on the table when we discuss nutrition in the multi-sectoral platform? And the question, it was a simple question from the Ministry of Labor saying, why should we do nutrition? We do, a whole lot of other things, but nutrition is not our area. That's for Ministry of Health, that's for Agriculture, that's for now Social Protection doing it and the rest.
So we badly need to mainstream nutrition.
Right, but you need to put it in that perspective of understanding what it means to that particular ministry. And when I unpack that through whatever we've seen in the report and our other conversations, that bringing in labor laws that are women sensitive, maternity benefits, workplace facilities, it suddenly strikes them that they have a role to play in the agenda of nutrition as in development agenda. So I think for us, the report has been extremely timely. It is now, we are using every opportunity to discuss this at the country levels, and we have some very positive responses and understanding from that engagement.
Let me stick with you very briefly, if I may, with a question about diets. We make, and Jessica made this point very strongly about the number of children who have a soda every day. Yet not enough countries, not nearly enough countries are doing anything to combat this. Isn't that just a simple entry point?
Yeah, I think it's a serious issue. A serious issue as in not being able to recognize what the problem is. And I think, again, the report helps us unpack that. Countries are beginning to question how they can learn from other countries that are doing things differently. And I've seen some very good examples coming from Latin America, where there are certain punitive actions, taxation for improper processed food, particularly the sodas. And I think it's a simple system that once we recognize, as I see it, once we recognize what the challenge is, we begin to start looking for answers to respond to it. And I think this is an important aspect, that sharing that data, sharing that information, getting that message across, I believe will make that change.
Thank you. Picking up on the data point, back to you, Jess, and you did tell us that we have more data than ever, but not nearly enough. Is that correct? What do we need to do to get as close to all the data that we need?
Well, I think we're at a point where technology, different types of data collection, we're really just at the very beginning of big data and data revolution. We see this whole area of geospatial data where you can really hone in on who is affected and where is an important technology that we're going to see more and more researchers start to use. It's not really a new methodology, but it's being used more and more, looking at food environment type data, density of markets, things like that.
There's the subnational aspect, right? Because some countries are doing not too badly in some regions and quite badly in others, right?
Mm-hmm. It's not even subnational, it's community level. That data that we showed with Africa is a 5 by 5 kilometers squared geospatial analysis.
So
it's very micro.
We need to disaggregate the data and then convince the government
Yeah.
that different policies need to apply in different
Yeah, I mean, disaggregated data is critically important. You know, the rural, urban, men, women, different age groups, different disabilities, all of that is important. But really using this high-tech stuff could be really critical. The other areas, the two areas that we really call for is the dietary data. There's a lot of new metrics coming out to understand what people are eating, how they make decisions, what they cost. Saskia Depay, sitting right here from World Food Program, has been working with her team on filling the nutrient gap, looking at the cost and nutrient gaps of diets around the world. And her work is presented, their work is presented in the GNR this year. But understanding costs of diets and where people are getting their food, we're getting more information around that. But again, we're at the beginnings of really understanding diets. The micronutrient status, this is a real gap. It is hard to collect micronutrient data in low resource areas. You need to take blood. Often you need to transport that blood. You need to send it to labs. This is complex stuff. So there is technology coming out of better ways to analyze micronutrient status through tongue swab samples, hair samples, fingernail samples. So there's lots of technology that we're just on the verge of. And I just want to mention one other thing. We in the nutrition community don't really think about the social media data realm and all of the data that's being collected of people's preferences, what they go to, what they're on Facebook. All of this data is incredibly important in understanding the desirability and the preferences of what people want in their food. And it's not just in high-income countries. Facebook is everywhere, and it's a huge data mine that we have not really tapped into. Can I just say one thing on the soda?
Yeah, absolutely. Yeah, say something about the soda, but I also want to segue into the role of social and behavioral change of communication.
Okay.
Because that's come up on slide.
Yeah, and I see it about the private sector. Now, the soda, sugar-sweetened beverages, junk food, unhealthy foods, this is a big issue. And governments can regulate and they can tax, and that's important. But we do need private sector, food and beverage industries to step up. Now, the private sector space is massive, right? You've got the multinationals to very small and medium enterprise type private sector. But to me, there are some among private sector, let's talk about the soda companies, some are doing good things and some are not. Some are going into new economies and getting new consumers. Can I say who they are? Maybe I shouldn't. Maybe. But I always be like too provocative. But there's some that behave well and some that just decided not to care. And you have to ask why. Why have some companies decided to not engage on the healthy or the sustainability agenda? Is it because they just have a huge share of the market and consumers are demanding those products? Maybe. But these are kind of the core questions we have to get at. We can talk about taxes and front of the pack labeling and government regulation, but there also needs to be a step up from industry to realize that providing healthy diets is good for business if they want a consumer base in 2100, if they want a consumer base in 2050. So to me, the whole soda is a bigger issue around industry and what kind of products and what kind of consumers do they want in the next 50, 100 years.
Point taken. Going back briefly to the need for disaggregated data,
Yeah.
I would like to touch on the issue of gender, which again is part of your mandate, Margarita, because we need to concentrate on women to improve diets and to improve access to healthy nutrition. How do we go about that, particularly when we're talking about women in isolated communities, low-income communities, and generally rural communities, which is very much IFAD's focus?
Thanks. And I would like just to start with the soda issue because it's
like
really
that one,
worrying.
don't we?
No, because it links very well with the gender issue. You see, because we work with very poor rural communities. That's our mandate, rural smallholders. And our mandate is to ensure that at least 50% of our beneficiaries are women. And that we also transform the lives of women so that they have a voice, they own land, they can own land, they can have access to finance, etc., etc. However, when we are successful in many of our projects in rural Africa, when they go to the markets to sell their produce, they come back celebrating that they made it. So they bring sodas for the kids to celebrate that they sold their produce. So the problem is even larger than that, because they obviously normally don't consume this. But it's when they go to the market to sell their produce that they feel proud that they could afford what we all here can afford any day of the time. So it has to do a lot with advertising and making sure that message we are giving is not that you made it if you can consume all these fries and packaged foods, but is changing the way we educate them. And as you were saying, one of the other issues we have is that in our analysis we have discovered that a lot of times are men the ones deciding the diet at home, not women. And for us also it's of concern because they think, they hear what the others eat. So for example, in a project where we wanted to change from corn to sorghum, which is a lot more nutritious and is able to adapt to climate change better, men told the women that are the ones growing the land there, growing the crops, that they wouldn't eat sorghum because that's for the pigs. Because in historical times, when some of the colonial powers brought corn to feed them in mass, they forgot sorghum. So now it's the women.
Corn became the prestigious.
Exactly. So I made it if I can eat corn 3 times a day. So when we came and told them because of climate change, really corn will not work, the men said there is no way. So, but women are so inventive that they invented recipes and didn't tell their husbands they were eating sorghum. And I must say that
The ruse is the answer.
in this case, it was fantastic. When we tried all these recipes, we said, you know, they had some muffins with macadamia nuts and cashew nuts that they were producing themselves in very small plots. And they were delicious. So if we really work with women, if we really empower them, and when we are able to reach them through education and public awareness, they really care, obviously, about their kids, but they also have the burden of the amount of work they have to put into the day. They have to grow the crops, get the water, fetch the wood, so and educate the kids and cook for the kids and clean the house. So we have to make sure that we reduce that workload to ensure that they can work in other very important areas.
And if I can ask you for a very, very brief answer, how do we communicate with women? Which brings us to that top question again. I don't know if you've seen the latest annual letter from the Bill and Melinda Gates Foundation, which has this line that data is sexist. We just do not collect enough data to know what women want, what women eat, and what women need.
Yeah. You know, it's not so much that we need, because in fact, when we go to the rural areas, is the way they organize themselves, for example, with the small banks, with the profits, extra profits, they organize a bank so that they can help each other. And they say it's better when we are earning the money because we don't drink all the beer our husbands do. Excuse me, husbands that drink beer on Fridays. But in the rural areas, this is very common. So they organize themselves. So it's very easy when you have women leaders, and we have almost in every community, there is a leader, there is a champion that can bring on board other women from other communities to join in. And very quickly, as soon as they see the benefits for the family and for their children, they continue investing. So it's relatively easy, but I think, as Jessica said, there is funding needed. We have all these loads of very successful stories, but we need to upscale that if we really want to reach the 2030 agenda.
Purnima, let me come back to you because, again, you're at the heart of global policy making when it comes to nutrition. There's a lot of talk, certainly at WFP, but more widely in the humanitarian community, of the humanitarian development nexus. There's the issue of nutrition in emergencies. How do we handle both at the same time? You have a very fluid situation in emergencies. How do we make sure that countries don't slide back on nutrition targets and at the same time build up nutrition from a development perspective into 2030?
Thanks. I don't want to steal, but I think I will steal WFP's slogan here, saving lives and changing lives. And I think to me that's a connect that I see. It is important to save lives in a humanitarian crisis at the peak of it. It is important to look at once again, and I bring this back in the context of both humanitarian and development engagement, to have a multisectoral approach. I think part of our problem in humanitarian response is nutrition in emergencies, looking at nutrition as a treatment. And I think nutrition has to be looked at across the board as an outcome, which is to me a development indicator, whether it is a humanitarian crisis or it is a development action. If we begin to look at it as an outcome, we will look at partnerships, we will build partnerships, we will make individuals and households more resilient to shocks. And when the shocks do occur, they will not go down to such a level that they have difficulty in bouncing back. So I think to me, it is the whole, the entire cycle is about making sure that we have well-designed early warning systems, early responses. We make sure that we work collectively in partnership and build the individual not as a sector, but as a collective of sectors across the board.
Thank you. Let me stick with you. Hang on to that mic, because we have a question which I think is really one for you, which is about the famous Mediterranean diet. We are in Italy. Is that the answer to global nutrition issues? Or would you like to take that?
Maybe Jessica can take that.
A lot of these territorial diets I think are important. But the idea of the Mediterranean diet is not just and the Mediterranean diet has a long history of having important health impacts, reducing cardiovascular disease, reducing Alzheimer's, a very cardioprotective type diet. Can everyone have a Mediterranean diet? Yes, you can instill some of the principles of a Mediterranean diet, which is really the WHO's healthy diet recommendations, very much is grounded with the Mediterranean diet. But there's lots of different diets around the world that have special attributes and have health components, like the Nordic diet, the pastoralist Maasai diet, the Japanese Okinawan diet. The thing is, a lot of these, I call them the disappearing diets. These diets are disappearing very rapidly around the world because of the globalization, trade, urbanization, people moving around the world. They don't necessarily carry those diets with them. I think that's one issue. I think the other issue is that the Mediterranean diet is not just the food, it's the lifestyle. It's the whole culture around the Mediterranean diet of what they documented in the Greek islands. So to me, it's not just about food, it's a whole way of living. And there was a great New York Times article where they were looking at centenarians, people who lived beyond 100. And they were looking particularly at one of the Greek islands that has and preserves the Mediterranean diet and lifestyle. At the very end of the article, the journalist said, "Why do you think you've lived such a long life?" to this old man. And he said, "I think I just forgot to die." And that's exactly the Mediterranean lifestyle.
That's a policy.
He encapsulated it perfectly. He's not thinking about, like, what food am I going to eat today and how am I going to construct a diet. He's living his life, and he's living it in the way that his land allowed for him to do.
So let's not die.
And, and how do we, there's one question about social and behavioral change.
Yeah.
To improve diets. Well, I think there's lots of ways to do that. We can take those principles of a Mediterranean diet and try to do that ourselves. You can be a Mediterranean diet eater by day and then a Nordic carnivore at night. There's lots of ways to do this, but I think to really get people to change, we need to ensure that healthy food is priced affordably. it's tasty, and it's convenient. If we don't have those three things, it's very hard to get beyond that. It needs to be convenient, tasty, and it has to be affordable. I think media campaigns have worked in some places to change behavior. Nudges, small, not unnoticeable changes in plate sizes, positioning salad bars in certain places. These positive nudges can be important. Giving information to consumers, like front of the pack, easy to read labels, but on top of it, if packages have warning signs, regulate it. Don't sell it in schools. Don't advertise it on TV when children are watching TV between the hours of 3 to 8 p.m., like Chile has done. And then the last thing on changing behavior is school-age children. They're forming their taste buds. WFP invests a lot in school meals. FAO is working a lot with the school-age children bracket of the life course, and that is the time to really instill healthy eating patterns and stimulate children's taste buds to be of healthier choices.
So a lot of frankly pragmatic stuff that can be done quite easily.
And we have evidence that suggests it does work. It does instill healthy choices. It's just not being scaled up.
Let me see if there are any questions in the live audience. There's a roving microphone if anyone has a question to ask. If not, we can go back to our Slido community. There's a rather interesting question, which is quite technical, so I need to make sure that someone can actually take this, which is the one in French at the bottom, which essentially says, why do we take the bran out of the rice, essentially, right? White rice is nutritionally poor. Is that, and does there need to be awareness on that? Anyone care to take that?
I think it's a very good point. We had not only that, but the fact, for example, in Tunisia, that because of climate, this white rice was dying, couldn't cope with it, and we had to go to one of the botanical gardens in the US to get the original Tunisian rice. And that rice was forgotten because it was brown and very small, not what maybe the European markets or the American markets want. So it's 10 times more nutritious than the white rice that had been produced for 20 years. So we had to go back to the original. And that happens with a lot of food products. It's just the beauty, how they look like. So in fact, our work is trying to go to first diversifying, because we need to have diverse crops, and also making sure that people recognize their own indigenous, I think, the forgotten diets. Many of those communities had their own diets, and now they are forgotten.
What you were saying before, the prestigious food is actually not the most nutritious. The gentleman there in the second row had a question.
My name is Maman Zelani. I'm working for NutriSet. First, I would like to thank you very much for the presentations. I found the nutrition report very useful. I'm trying to look at it with a prism of research. And I was wondering, you were diagnosing how malnutrition is today in terms of figures, but also new features like children having both stunting and wasting, children having overweight and stunting. But also, in the report, it is mentioned that we have accumulated much knowledge compared to before. Would you consider that we have enough knowledge and tools to address these issues, or would you think that there is a new research agenda to develop new tools, new solutions?
That's one for you, Jess, I think.
And I think, well, I'm a researcher. I'm always going to say we need more evidence, right? I mean, sometimes I think it depends on what it is and what we're focusing on. I think there is a lot of evidence about where the burden lies. And countries are working hard to collect their own national data. The data that we show in the Global Nutrition Report has been vetted by UNICEF and others. And we have a lot of countries say, well, we actually have more data than this, and you're not showing it. So I think there is a lot more data to be. I work a lot in Timor-Leste. Timor-Leste has collected so much data that they don't even know what to do with it. So I think we have a lot of data. I think we need to get at the nuances of understanding some of the causes and consequences of malnutrition. Particularly, a lot of countries have made big strides in reducing stunting. They've got that last 30%. You know, and then you're getting into kind of these deep underlying issues. This is the stuff that's sticky. It's hard to do. We don't really understand it. And it gets into more broader development issues. You know, and questions about consumer behavior. Behavioral economics, behavioral science is a growing field. We understand that. But we don't know enough about what makes consumers tick. I don't even understand what makes me tick. Why do I pick the potato chips and not the banana? I don't know. I'm a nutritionist. But these are the kind of issues that I think we don't completely understand. And I think
psychology of food needs and so on.
Yeah, I think we haven't focused enough on the anthropology of food and the culture of food, which is so critical for nutrition. And we often call for multi-sectoral approaches. Purnima knows this intimately. We don't know how to make that all work together. Do you press all the buttons at once? Do we make multi-sectoral actions simultaneously work? We don't really know that yet. We argue yes, but how to do it is the challenge. So there's a lot of questions around implementation of what the evidence is and how do we actually implement it in a local setting with its own set of issues and politics and players. That we don't understand as intimately.
So we're tipping over almost into user experience data. There's a question here, and I have to learn finally that the more you ask people not to use acronyms, the more they do. So we have a question about CFS, which I believe is the Committee on Food Security. The question, there are actually two questions along those lines. CFS is working towards voluntary guidelines on nutrition. What should the very first recommendation be? Purnima, would you like to address that?
I think we should have the CFS chair answer that, who's sitting in the audience. Or did you ask the question?
Thank you, Doctor. Actually, it was one of my staff members, Ms. Kuzmicheva, right here. She asked me, should we ask a question about this? And I said, sure, go ahead. So I have some ideas myself about it, but as you will understand, I don't want to contaminate the pool, so to speak. And I would also like to hear from the actual experts, because the process of what's going to be in the guidelines is a political process. And so that's a discussion for another day. But it would be useful for all of us to listen to the experts and get some guidance. Please.
Okay, Margarita, can I ask you to keep it brief because we are close to the deadline?
I think politicians listen about costs. And I think we have to ensure that countries do the analysis of the economic cost. Don't talk about environment, social. The economic cost of malnutrition, all the ways of malnutrition, to understand that, in fact, they should be investing to save money. That is the main message. If we invest in malnutrition or in good nutrition, the governments and developing world will save billions of dollars a year.
Again, very, very briefly, how much more do we need to invest to make a difference?
Well,
order of magnitude.
It's difficult, of course. In our case, we dream, but it's context specific. Some countries will need a lot more than others, depending on what they are right now. And some countries will need to invest in different things, in education, in maternity, in the health of adolescent girls. So it's very varied, but the important thing is that governments own the issue, and that is what we are seeing now. There is no ownership. There is not enough understanding of the problem and the consequences of the problem.
So the deficit is one of expert-driven political will.
Exactly.
In that sense. Okay, very briefly, because we need to wrap up before closing remarks. May I ask you, again, in just a few words, one line if possible, in turn, to tell me what you think the call to action is now, from the report itself, but more broadly as a major, urgent global policy issue. Purnima.
Okay, I think from my perspective, I look at two things really as call to action. One is on building our partnerships, building on collective action, and it kind of connects to what we're talking about as a systems approach. And the other is to make, I asked the question in a way to make, why is healthy food more expensive than the unhealthy food? And I think to me that's an area that we need to look at much more deeply to say, and I think Jess used the term saying make it convenient, tasty and affordable. That's what we should work towards.
Excellent. Make healthy food affordable. Margarita.
Well, I think we have also the issue of desirability, and we want the adults to desire eating that food. So I think changing the policies of public procurement to sustainable consumption procurement for schools would make a huge difference if we teach our children to eat properly. So it's not just us as adults, but the children need to eat properly. And also another message from us is that we need to work harder into making value chains having a nutritious focus, because that it will affect what we are going to get to the markets and how we make affordable, nutritious food in the markets. So nutritious value chains.
Friendly procurement in schools and in value chains. And finally, Jess?
I would say that, largely I've been pretty disappointed with governments around the world in the sense that I think we really need to strengthen government policies that focus on improving diets. I think it's just been a dearth of interest and commitment to look at diets. Most countries don't even have dietary guidelines. So to me, it's strengthening government policies to improve diets and govern your food system. Learn who's working on what and doing what in your food system. So to me, that's the big call, is a call to action for governments to start getting on the diet agenda.
Thank you so much to all three of you. We're far from having exhausted the subject, but I would like again to credit you and thank you very much for being here and giving us at least a few insights into what's shaping up to be a major development issue in the years to come. Thank you. And before you go, I would like to hand over. It would be really remiss not to go across the road to our colleagues at FAO, at the Food and Agriculture Organization of the United Nations, for the last few words. And I'm pleased to welcome to the lectern Anna Lart, who is Director of Nutrition at FAO. Anna.
We are very happy that you could join us today for this launch of the Global Nutrition Panel, of the Global Nutrition Report. Sorry, there's another panel on that. I also want to thank you, Andrea, for your excellent facilitation this morning. Anytime we launch the Global Nutrition Report, for me, I find it very inspiring because it goes to the bottom of the issues, issues about data and all of that. So I think it's great. We've all had the issues today. I think there are two take-home messages that came out of this report. The first take-home message is that ending malnutrition is within our reach. I'll say it again, that it is within our reach. Jessica made it so clear that we know so much more now, and we have so much experience. Very often, we talk about the numbers. We talk about stunting numbers, overweight and all. There are faces behind this. We should keep this in mind every time. There's a face behind a stunted child, and that child also has a future that can be disrupted as a result of the situation in which they find themselves. I think with all this information, it's not just information to just keep, but we have to act on it. And I think we are well positioned as in this generation that we have the information to take action. And we can make this generation the generation that will end malnutrition in all its forms. The second take-home message is that we must act now if we want to make progress. And indeed, to prevent the reversal of the progress that have been made, we've seen hunger numbers actually increasing. I think we cannot afford to delay on the action. We must act in areas where the impact is greatest. We have talked enough. We have made the case for nutrition. I think we all know that the impact if we don't address malnutrition. We have a lot of global resolutions and all. I think the last resolution that came up was in January 2019 on the global health and foreign policy, looking at healthier world through better nutrition. These resolutions actually set the stage nicely for all of us to act, every country to act. These resolutions have been signed on by every country, so it is now time for us to take action. I think our biggest loss will be that we have the decade of action on nutrition. 10 years will pass by. 10 years, we have started counting, and we will not get to where we want to get to. I think that will be a missed opportunity. We may not get another 10 years to address, in a decade declared by the UN, for us to address malnutrition. So let's push hard and make the dent we want to make in addressing malnutrition in all its forms. I think Jessica made it very clear. We know where to act. She talked about we need to act on data, because without data, we are just guessing. Some have said that, without data, we cannot really know where we are going. If you aim at nothing, you will always hit it. You hit nothing. So we must measure and measure what matters. And you agree with me that nutrition matters. And so we really need to act on it. The other thing we need to do is that we need to act on finances. I think it became very, very clear. We need money. We need to put money where we can make the most difference. Our donors, businesses, philanthropies should come to the table to increase commitment, even in these challenging times. We also need domestic financing. We've seen some increase. I think a country that puts a clear budget line for nutrition, when a country puts a clear budget line for nutrition, we can be sure that the country is ready to take action. Jessica mentioned in her presentation the opportunity presented for us for the Nutrition for Growth in Japan 2020 Summit. We want to see commitments in various forms, policy commitments, and also financial commitments to move us forward. We also need to act on our diets. For me, this is the most exciting part for working in an organization that looks at food and agriculture. Our food systems shape the way we eat. Now, food systems has become a buzzword, the other buzzword. But the truth is that our food systems are failing in various ways. Healthy diets are unaccessible and unaffordable. It has come up here. Hunger numbers are increasing. The food system is not producing equal and equitable benefits, and our food systems are not environmentally sustainable. It is time to transform our food systems to make nutritious, safe, affordable, and sustainable diets available to all. I mean, we need the right policies, incentives, and commitments to take action. The document talks about 5 things that can be done. Also, the recent Eat Lancet article released in January talks about 5 transformative actions that the world needs to take immediately to put the food systems on the right path. And we need to look at this too. We need to act together. The issue of malnutrition is too complex to leave to one group alone. For a long time, addressing malnutrition was left to the health sector. It's because we didn't really understand the complexity of the issues we are dealing with. There are different actors in the food systems who shape the way we eat. All these actors must come together to tackle the forms of malnutrition we are talking about. And I would like to emphasize that the private sector has a role because they play a part in the food systems. We cannot leave them out. They have always been, we decide, should we include them, should we not? Look at how much of the food you eat in a day has the touch of the private sector. I think we need to involve them in shaping the food systems in the direction we want. And at the same time, this appeal to the private sector, that they should see this unique opportunity to show that they can contribute to good nutrition and still make profit. Finally, we need to commit and be accountable. We need to make the decade a reality, the nutrition decade we have, the 10 years to addressing malnutrition. And I think that the Global Nutrition Report is helping to move us in the direction we want to go to in bringing out all these issues. I think we need these truly smart commitments and measurable commitments. Jessica threw out a challenge that, why are things not getting better when we know so much more than we did before? I think as we reach the midpoint for the decade, we need to commit to leading the charge that has been given us to make the future a brighter future for our children and in the generations to come. And I firmly believe that we can be the generation that will change things. Someone has said that if we lose the opportunity, the worst can also happen, and that is we would be the first where the parents will have longer life than their children. I think that is very scary. And we really need to do all we can to put the food systems right and really address malnutrition and make it something of the past. Thank you all for your attention.
Thank you so much, Anna, for laying out the pathway so clearly, but also injecting so much passion into it. As well as Anna, I'd like to thank our panel today. Thank you, the audience, both live and online, and not least thank the real driver behind this event and the person taking us forward in terms of nutrition into the future here at my organization, WFP.